Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz, current chair of the Abington Board of Health. And with me is our health director, Marty Golightly, and our public health nurse, Lindsay Wright. Good morning, everybody.
Good morning.
Good morning.
So where are we with numbers in Abington so far? It seemed like yesterday's update, we were on the uptick again.
Again today. This morning I cleared a bunch of cases off, pulled a bunch of cases from the website. We're sitting at 45 active cases right now, which is up even with me clearing cases. And from yesterday, we have 1,721 removed from tracking and 47 quarantined. We just haven't investigated the cases that we pulled off this morning because it's still real early. So that number will go up. So we're definitely seeing it increase. It's slowly ticking back up. So just got to be real vigilant and careful, paying attention to, good hand hygiene, mask wearing.
And we are not the only one reporting these upticks. The state reported almost 1,900 cases yesterday, the vast majority of which are under the age of 50. It's not even close. It's actually the majority of under the age of 30. So I'll put my epidemiological hat on. Do I think that this is probably because the prevalence of those variants that are a little bit more infectious are now overtaking the previous virus that was in Massachusetts? Probably. Does that change any of the things that we're doing? Not even a little bit. You still be wearing your mask, you still be washing your hands, you still get whatever vaccine is available to you.
And I was contacted by one local media outlet yesterday asking if we were aware of or knew about the outbreak in Weymouth. So I hadn't heard anything. If there's a large increase over there.
We are aware of it.
Somebody else's town.
Yeah, we work closely with all the surrounding towns, especially if there is an outbreak. So we are aware what is happening in our neighboring community.
Yeah, and most of our contact tracing is done in-house, and will continue to be unless we're doing large shot events, which you never know.
All right, vaccinations. Where are we with that? There's been some update to the state guidelines, correct?
Yeah, so I want to talk about by the end of the month of April, all of Massachusetts will be eligible to receive a vaccine. And there's a steady increase in which the link of which has been posted on the website. Go to abingtonma.gov, go to news and announcements, and it's the first one on the right. Now that the vaccine is opening for larger populations, I'm getting a lot of, why would I, as a relatively young, healthy adult, want to get the vaccine? Especially when you consider survival rates are around the 99th percentile. Well, survival rates are not the only thing to consider when you are choosing whether or not to get a vaccine. Saying you have a 99.9 whatever chance of survival doesn't really capture the whole picture. Researchers are still learning about the potential long-term lasting effects of even mild to moderate COVID infections in some people. Even non-severe infections in young people have shown risk for damage to heart, lung, blood vessels, and a small fraction of those cases, other organs. Many of these health problems from COVID will likely get better, but we don't know what percentage yet. So when we are thinking about whether to recommend the vaccines or not, we're thinking about these types of effects in addition to survival rate. So we want to make sure that people understand the whole picture. And that determination, the benefits of the vaccine, always outweigh the risks, even in young people. And just a friendly reminder that kids have now entered clinical trials, even here in Massachusetts. So we'll wait to see that. But we talk about what outweighs the risk. This doesn't mean that the risks are zero. It means that they are a far preferable alternative to a COVID infection. When you are making this decision for yourself, weighing your personal risk versus benefits, you can't only think about your survival chances against COVID. You have to consider other potential short or long-term health effects and impacts of a COVID infection. So, and that's not even even mentioning the topic of asymptomatic versus symptomatic spread that the vaccines may or may not prevent. And it seems like the science is leading us in the direction that they are being prevented from the vaccines. So while I encourage everyone to talk to their doctor and make the best personal decision for them, don't just think of a COVID vaccine in the small microcosm of survivability relates. There's a lot of other factors that should be considered. And we strongly recommend getting whatever vaccine you are eligible and have available for you. And we will continue to do so. If you are interested in any of the scientific literature, send me an email. I will happily provide you with as many nerd links as I possibly can, because I have lots of them. And you can educate yourself. And when I say scientific journals and the science data, I'm talking about clearly researched, open sourced, peer-reviewed research, not something you read on the internet. There is a vast difference between something that scientists have spent hours and hours combing through to verify data, to see if they can reproduce that data in their own labs. That's what peer reviews means. Some scientist says a thing, other scientists try to reproduce that thing. That's what peer reviewed means. So we'll look at that data, because that's what the data that is important. Ignore everything else. The media, what your friends tell you, what Facebook or Wikipedia, what all this is, the things that we are looking at. And when I say we, I mean the health department as a whole, and I'm sure Lindsay will support me in this. We are looking at peer-reviewed data. We are looking at the scientific journals. That's what we care about. And that leads us to make the strongest possible recommendation for whatever vaccine you have availability to get now and in the future. If you are a young, healthy person, we strongly encourage you to get vaccine, because you're doing it because we simply don't understand the long-term risks. And I hope that helps. Again, call me, email me. We'll get you anything that you need to know, or all of our data as much as possible. Now, we did a video with Dr. Boulay. I encourage everybody to go watch that.
Yep. And as a reminder to people, the vaccinations are still being limited to mass vaccination sites in the state. So check with the state's website on availability. And I think.
Yeah. Go ahead, Lindsay. Sorry.
No, I was going to say, so second shots, we should be able to provide if you received your first with us. Again, the homebound population, if I'm unaware, please give me a call and we'll get you on our list and make sure that we get you taken care of. And then just to kind of tack on to what Marty said, if you're looking at these and you're not sure if what you're reading is real or peer reviewed or have any, just call us. Both of us read a lot. And, I'm confident to say that either one of us who answer the phone are more than able to either answer your question or point you in the direction of someone who can better answer the question. Marty's very connected. Dr. Tom is a great resource for us. And I like to think that I can break stuff down from the scientific journals to a level that anybody can understand pretty quickly.
I think Lindsay she's being a little humble there. She has a good skill set of breaking the smart guy language down into small bite-sized bits that people can understand. So if you're having problems with it, I encourage you to give us a ring, and Lindsay will be able to break it down for you. Furthermore, we don't have any financial or there's nothing in it for us with the vaccine. So I want to make sure that people understand that. It is just what I believe is good for our community and our society as a whole. And I do want to mention the senior housing. We will be able to get their second doses. I also want to mention that we are still strongly advocating for Abington's Health Department, paramedics, and our MRC team to be able to vaccinate large amounts of our residents here. That's not going to stop, because I anticipate sometime in the near future, whether it be the first quarter of next year or the last quarter of this year, that there is some version of the COVID vaccination for children. And, we want to also provide that in a comfortable environment. And if other areas and other doctors aren't thinking about that now, I think they're being short-sighted. So we have already started those conversations, like how do we do large amounts of children, because that is a completely different animal than come in, sit down, get your shot, get out. That's not that we do that anyway, but there's a lot more that goes into it when we talk about pediatrics.
A lot more distraction.
Stalking,
Yeah.
yeah, lollipops. We need lots of lollipops.
But if anyone got their flu shot with me,
and I will.
nope. Go ahead, Chris.
They know.
No, if anyone,
I was just going to back you up.
if anyone received their flu shot, they know that with us, they know that we have all the props for distraction and tricks up our sleeve to make it as not scary as we can.
Yeah, my daughter's terrified of getting shots, and she still talks about how cool Lindsay is. Definitely,
We do our
these are the best. And I further encourage people, if you got questions, to ask. As a member of the Board of Health, I get a lot of questions, and the only reason I sound smart is because I'm talking to Lindsay and Marty. So, do encourage you to call. Did either of you had anything else for us today? Or?
No, I don't think so. I'm all set. Lindsay?
I'm good.
Chris is a little glitchy this
All
morning.
right, I will remind people, if you have questions or anything specific you'd like to see us. I'm calling from the middle of the woods. If anybody has any questions, feel free to reach out to either Abington Cam or directly to the Health Department. And I would want to remind people on a non-COVID related note, we've got some beautiful weather forecasts for this week. The ticks are already out, so be careful and mindful of that because Lyme disease is also not fun. Thank you, Lindsay. Thank you, Marty. And thank you, Kevin at Abington Cam. We'll catch everybody next week.